Close your eyes and try to imagine you and your significant other in the delivery room at the hospital. Nurses, doctors, family members running around, waiting for the arrival of your new baby. After 40 minutes of pushing, your beautiful baby is born. The nurses inform you you have 1 hour to spend with your newborn until they must take them to the hospital nursery to finish getting cleaned up and to complete the newborn screening test. So how do you spend that first hour with your newborn? Well, the World Health Organization website states that early initiation or breastfeeding within the first hour of a baby's life ensures that the infant receives the colostrum or first milk, which is rich in protective factors. Now, the first milk is the most natural start that a mother can give an infant, and continuing to breastfeed beyond that first hour can have benefits that extend through life for not only the baby, but the mother as well. So today I want to talk to you about how the subject of breastfeeding is nearly taboo, about the studies that show that breastfeeding increases a child's health and wellness, and how breastfeeding prevents health complication. So let me start by talking about some of the stigmas that surround breastfeeding. Often, breastfeeding is looked upon as grotesque or something that it grosses people out. When in fact, breastfeeding is the most natural form of nourishment for a newborn mammal. Often, women are shamed in public for breastfeeding at the store, the grocery store, at a restaurant. They're shamed for this. And to counter this, 49 states have laws allowing women to breastfeed in public. That's according to the National Conference of State Legislators, June 5th, 2017. Now, not only that, women also have the common belief that breastfeeding will ruin your body, when in fact it's the opposite. Breastfeeding can actually help a woman reach her pre-pregnancy state. Now let me discuss some of the many benefits of breastfeeding for both baby and mom. Studies show that breastfed children are sick less often and avoid major illness better than non-breastfed children. Breastfed children have about half as many ear infections as non-breastfed children. And along with those ear infections are other common colds, other common viruses, which breastfeeding also decreases the chances of acquiring. This is because of the overwhelming amount of antibodies that is found in the mother's breast milk, and that's passed along through breastfeeding to the child. As well, the risk of SIDS, which is sudden infant death syndrome, decreases by 36%. Sudden infant death syndrome, or SIDS, is another term used to explain, it's given to explain the unexplainable death of an infant. Now again, also the mother gains benefits from breastfeeding. It'll help her reach her pre-pregnancy weight. Not only that, lower cancer rates from breastfeeding. Breast cancer rates go down by about 28% for the mother, as well as ovarian cancer. The risk of getting ovarian cancer is reduced by about 21% for those women that breastfeed. And that's according to the AH9R report of 2007. So now that we've talked about some of the benefits of breastfeeding, let me tell you about the flip side. Many diseases and illnesses infect people all around the world each day. Breastfeeding can reduce the risks associated with these diseases. Antibodies, as I have stated, live in our bodies that protect us from illness and disease. With the ability to breastfeed, the mother has the opportunity to pass these antibodies along to her child, reducing the risk of becoming infected with a deadly disease. Diagnosis of new and rare diseases are constant. This is every day. We're coming up, we find new viruses. And protecting your children through breastfeeding can very well prevent having to deal with the sickness or even the death of an infant or young child. And that is not something that any of us would ever want to think of. We can help prevent tragedy within our families by taking that first step to breastfeeding. And now that you know about the impacts of breastfeeding, you can make a better informed decision for yourself and for your family. So when you have children, how many of you can say that you will definitely breastfeed? And for those of you still on the fence, will you at least consider and discuss these benefits with your partner and your healthcare provider before making a decision that can affect your children for the rest of their lives? Thank you.